Ozempic and Wegovy, two drugs that everyone's talking about, in part because they have the potential to be life-changing for millions of Americans struggling with type 2 diabetes and or obesity. Both drugs are produced by one of the most profitable pharmaceutical companies around, Novo Nordisk. The Kaiser Family Foundation looked at prices for these weight loss drugs and found that the list prices are significantly higher here in the United States than in other countries. For instance, Ozempic is $936 a month here in the United States. It's under $200 in Japan, Canada, Germany, and the Netherlands. Under $100 in the United Kingdom, Australia, and France. And Wegovy costs more than $1,300 a month in the United States. Wegovy does. Only around $300 a month in Germany and the Netherlands. Now, one senator wants answers as to why these prices are so, quote, outrageously high. And independent Senator Bernie Sanders from Vermont joins us now. He is the chairman of the Senate Health, Education, Labor, and Pensions Committee. Senator Sanders, thanks so much for joining us. As you know, in March, researchers at Yale found that both Ozempic and Wegovy can be profitably manufactured for less than $5 a month. Why are Americans being charged more than any other country for these drugs other than profits?
Well, I would use the word greed, but you could use the word profits. Look, you know, Jake, you well know that we are a very politically divided nation. But there is one issue that brings Democrats, Republicans, and independents together. And that is the American people are sick and tired of being ripped off by giant pharmaceutical companies who are charging us not just more than other countries for the same product, sometimes 10, 15 times more for the same exact product. And that has got to end. Now, as you've indicated, Ozempic and Wegovy are very, very important new products, they're game changers that can have a tremendously positive impact on the lives of millions of people. And I really do want to congratulate the scientists at Novo Nordisk for their important work. It's going to save lives all over the world. But this product will mean nothing to an American who has diabetes or dealing with obesity if you cannot afford that product. And that is the case. There are estimates out there that thousands of people will die unnecessarily simply because they cannot afford this product, which is sold so much more expensively in America than in other countries. Second point, if Medicare and Medicaid cover Ozempic and Wegovy, there's going to be a huge increase in spending on those two important federal health insurance programs. Mm-hmm. In fact, it's going to bankrupt Medicare. So we have got to get a handle on this. I have invited, and he will come, the CEO, Mr. Jorgensen, of Novo Nordisk, to come before the committee and simply explain why he thinks it's appropriate to charge us 15 times more than the people in Germany or the UK.
So obviously, I can't defend those prices, and I'm not here to defend. But I do want to ask you a philosophical question. Because a couple of weeks ago, I met Roy Vagelos. Roy Vagelos is the scientist, the former chairman and CEO of Merck. And he told me about how Merck not only developed statins, but helped develop a product that treated parasitic worms. Yeah. And Merck ultimately donated the medicine to prevent 55 million Africans from getting river blindness. And yeah. I guess my question is, given the costs of research and development and acts like that, and I know are not the norm, but do happen, how does the Senate decide what is appropriate for private companies to charge and what is not?
Well, that's a good question. And look, I am not anti-drug companies, as you indicated. I mean, major breakthroughs in area after area. But let us also not kid ourselves. Right now, drug companies, you have the 10 of the top drug companies in the world have made over $100 billion in profits in the last year. As we speak, Jake, right here on Capitol Hill, there are 1,800 well-paid lobbyists right now running all over Washington to make sure that we do not lower the prices of prescription drugs in this country. Many of these drug companies give their CEOs tens of millions of dollars a year in compensation. They do stock buybacks, etc. They are enormously profitable. So the question that you're asking is, how do we develop a system which allows the system to fund the important research and development that we need so that we come up with groundbreaking drugs to deal with important diseases that are out there. This system that we have right now, which is ripping off the American people, just is not working. And the simple question that the pharmaceutical industry has got to ask ourselves, they make money selling Ozempic in Germany for $59. How much money are they making here in the United States selling us that product for almost $1,000? That's the question that has to be answered.
So we reached out to Novo Nordisk for comment. A spokesman said, quote, "We look forward to discussing solutions that ensure access and affordability for all patients within the complex U.S. healthcare system," unquote. Do you have confidence that the company is willing to work with you to find a compromise? It wouldn't be the first time that you were able to achieve something like that.
Well, I certainly hope so. And look, they are right. The system, our healthcare system, is obviously broken and dysfunctional. We spend twice as much per capita on healthcare as people of any other country, and our results are often not as good. And the pricing system within the pharmaceutical area is also clearly broken. And what they will tell you is, well, you know, we give rebates, and they do. The PBMs get a 40% rebate, but at the end of the day, the price they are still charging after the rebates are much higher in the US than in other countries. And for the average person who doesn't have any insurance, who walks into a drugstore to buy the product, they're going to pay list price. If you have co-pays, if you have deductibles, you're going to pay a hell of a lot of money. So I would hope, I really would hope, that Novo Nordisk sits down with us and says, okay, we are not going to end, we're not going to continue to rip off the American people. Canadians pay $150, we're paying $900 and some odd dollars. Let's substantially lower the price that the American people have to pay for this.
Let's turn to another issue that you care a great deal about.